Hello everyone, I am Dr. Sowmya, consultant dermatologist at Manipal Hospital Sarjapur Road. I am going to brief you about dandruff now. Dandruff, as you all know, is a chronic condition which commonly affects most of us. It is caused by an excess oil production on the scalp along with excess sweating, lack of hygiene and a fungus that grows. A fungus called Malassezia is commonly found on the scalp of almost each and every healthy individual. Not everybody develops dandruff. When your immunity towards this fungus is low, there is a high probability of developing dandruff. How does dandruff present? It presents as greasy scales on the scalp. There can be itching and sometimes it can be associated with a lot of inflammation in the form of redness or oozing. When it is associated with a lot of redness and oozing on the scalp, it is called seborrheic dermatitis. Can you oil your hair when you have dandruff? Oiling actually increases the problem. Your hair has got enough oil to keep your hair itself nourished. That is the function of the oil secreting glands. And dandruff develops after puberty. That is when the oil secreting glands start producing oil once the action of the hormones sets in. If you add additional oil, you are only going to increase the problem. So, if you wish to oil your hair, you can still oil it, keep it for a couple of hours and then wash it off. What are the treatments for dandruff? So, dandruff can be treated with certain oral antifungals and also shampoos which have got ketoconazole, zinc pyrithione, salicylic acid and coal tar. Ketoconazole is an antifungal and it kills the Malassezia which is there on the scalp. Zinc pyrithione acts as an anti-inflammatory agent. Coal tar and salicylic acid, they have got anti-mitotic effect, that is, they decrease the rate at which the cells are produced on the scalp. Seborrheic dermatitis, that is the inflammatory variant, will need an additional application, that is, a corticosteroid solution has to be applied on the scalp to bring down the inflammation. Then how do you differentiate between psoriasis and seborrheic dermatitis? Many people have very big scales on the scalp and it is often confused with dandruff. In psoriasis, the scales are white and much bigger in size. The plaques are even more redder, they are more erythematous and sometimes they extend beyond the scalp line. In addition, you can also see plaques on other areas of the skin like the elbows and also the knees. Psoriasis is once again treated with steroid applications. We also give shampoos which have got coal tar and salicylic acid when people have psoriasis. So, psoriasis is a chronic condition which has got relapses and remissions. Seborrheic dermatitis can also present with scaly plaques on the face, especially the T-zone of the face, that is like inner aspect of your eyebrows, by the side of your nose, by the side of your mouth and also on the mid-chest and also the upper back. When it is very bad, you can also see small pus-filled lesions and we term it as seborrheic folliculitis. When there are features of both psoriasis and seborrheic dermatitis which exist on the scalp, we term it as sebopsoriasis. It needs treatment with both antifungals, that is the shampoos having antifungals, topical corticosteroid applications and also shampoos which have got salicylic acid to remove those bigger scales.